Ultrasound. What is it? And how are we going to use it in the physical therapy practice? Basically, ultrasound uses acoustic energy, vibratory motion, propagated through the tissues. They use frequency, which is the number of oscillations per second, or the hertz. 1 hertz equals 1 cycle per second, and 1 kilohertz equals 1,000 cycles per second. The most commonly used frequency is 1 million cycles per second, or 1 MHz. Ultrasound. What is it? And how are we going to use it in the physical therapy practice? Basically, ultrasound uses acoustic energy, vibratory motion, propagated through the tissues. They use frequency, which is the number of oscillations per second, or the hertz. 1 hertz equals 1 cycle per second, and 1 kilohertz equals 1,000 cycles per second. The most commonly used frequency is 1 million cycles per second, or 1 MHz.
Ultrasound waves. These travel greater through solids, less through air. You're going to want to make sure you use a coupling medium, which is the water-soluble gel. The molecular flow is parallel to the direction of the wave propagation, and energy travels further away from crystal waves.
All right, some of the biophysical characteristics of ultrasound. They're the same characteristics of radiant energy, and they can be transmitted, absorbed, refracted, or reflected. The depth of penetration of ultrasound is inversely related to frequency of the ultrasound energy and is also inversely related to the coefficient absorption of the medium. So if you have 1 megahertz set as your parameter, it will pierce deeper than 3 megahertz. So for example, 1 megahertz penetrates the skin 3 to 5 centimeters, whereas 3 megahertz setting only penetrates 1.5 centimeters in depth.
So there are basically 2 different types of ultrasound that you can apply on your machine that you have over here. So you can set it to thermal or non-thermal. During thermal, it basically has a rate that the energy is applied, sort of a heat energy that you'd feel on the skin. It's dependent on the length and time that you set on the parameters, thermal conductivity of the tissue, and the rate of perfusion of blood to that exact tissue that you're applying it. If you have non-thermal, it's just going to send out the vibratory effects of ultrasound. You'd use it for micromassage, to increase the membrane permeability, or for cavitation.
Alright, for the indications, you can use this on joint and soft tissue contractures, DJD or RA, muscle injury, neuromas, reflex sympathetic dystrophy, plantar warts, open wounds, or chronic systemic peripheral disease.
Some contraindications for ultrasound. If the patient has a cardiac pacemaker, is pregnant, has cancer, or thrombophlebitis, if they have a hemorrhage, an epiphysis, or if there's also X-ray or radiotherapy already in conjunction with your patient, then ultrasound is contraindicated. If they have cardiac disease, and ultrasound is not to be done over the eyes, spinal cord, or testes.
What are some precautions? Unhealed fracture, primary repair of tendon or ligament, osteoporosis, or plastic or metal implants.
So there's 2 different modes. It can be continuous or pulsed. Continuous, you're going to feel that thermal effect. And then you've got the dosage. You have the intensity, the frequency, and the size of the area.
All right, so when thinking about your technique with the ultrasound, you have to think of the method of application, so if it's going to be the pulsed or the continuous, whether it's going to be direct contact, immersion as through water, or a bladder where you have a separate medium with the gel.
So ultrasound in particular is soft tissue shortening. With these studies, ultrasound was used on actually having the muscle on a static stretch. And overall, the studies indicated that ultrasound of sufficient intensity and duration may increase the soft tissue extensibility. And these parameters that we'd be using would be a frequency of 1 to 3 megahertz, intensity of 1.0 to 2.5, and a duration of 5 to 10 minutes. Once again, the frequency determines the depth of the tissue perfusion.
So you can use ultrasound for dermal ulcers. The purpose of this would be to accelerate the healing of the vascular and pressure ulcers. The treatment parameters for this would be a frequency of 3, the duty cycle of 20, so a pulsed, intensity from 0.8 to about 1.0, duration from 5 to 10 minutes, and you want to make sure you apply it to the peri-wound area. You can use the immersion technique or you could use the bladder technique.
Tendon injuries. The purpose of ultrasound use on acute injuries in particular would be to increase membrane permeability, increase cell degranulation, increase histamine release, increase rate of protein synthesis by fibroblasts, and increase macrophage responsiveness. In the case of a chronic injury, ultrasound will accelerate metabolic rate, reduce muscle spasms and pain, alterate the alterations of nerve, conduction velocity, increase circulation, increase soft tissue extensibility. With an acute tendon injury, the treatment parameters will be as follows. You would have a frequency of 1 to 3 megahertz, a duty cycle of 20%. Your intensity will be set at 0.8 to 1.2 with a duration of 5 to 10 minutes. And you'll space the treatment over 12 different times over a 4 to 6 week time span. For chronic tendon injury treatment, you will set your frequency to 1 to 3 megahertz with a 100% duty cycle. The intensity will be 1.0 to 2.0 with a duration of 5 to 10 minutes. And again, your treatments will be spread out through 12 sessions through 4 to 6 weeks.
Alright, you can also use ultrasound for bone fractures. There have been prior reports as fractures being a contraindication, but recent studies support a low-dose ultrasound for acceleration of the fracture healing. The suggested parameters for this would be a frequency of 1 to 1.5, a pulse duty cycle of 20%, and a duration of 15 to 20 minutes.
Carpal tunnel syndrome. So studies do not support the usage of continuous ultrasound with carpal tunnel, but recent studies have shown that there is some use for pulsed ultrasound for carpal tunnel. The proposed mechanisms would be the anti-inflammatory effect that pulsed ultrasound has, and also the tissue stimulating effect. Suggested parameters for using for pulsed ultrasound on carpal tunnel would be a frequency of 1 megahertz with a duty cycle of 20%, an intensity of 1, and the treatment time will be 15 minutes.
So you can also do phonophoresis. So with an application of ultrasound, you basically add a topical drug with the application gel. Ultrasound is intended to enhance the drug penetration by the vibratory effects increasing membrane permeability of the drug. It basically has some benefits over oral drug usage though. There's some higher initial drug concentration, and it avoids gastric irritation in the bowels, and it also avoids the first pass effect by the metabolism of the liver and the drug. Many published studies actually support the usage of phonophoresis for drug delivery. However, it's usually not too common in the clinical setting. Suggested parameters would be a frequency of 3 megahertz, duty cycle of 20% to get the max absorption by the skin, and an intensity of 0.5 to 0.75 with a duration of 5 to 10 minutes. And now Ashley's going to demonstrate the proper application and setup process for ultrasound on Brendan.
So the first thing you want to do is to make sure you turn the machine on. Once this gets going, you can change your time to the settings that you need. We'll set it up to 8. You can use a frequency, or an intensity, usually somewhere around 0.8 to 1.0. You can change, this button here will show you whether it's pulsed or continuous, 20, 50 continuous, and then finally you can change the frequency here, so you can have 1 or 3.3. Once you've decided what you want, you can go ahead and push the start button. You'll take the applicator with the gel and you can start your treatment. Once you're done, you want to make sure you push stop before you take the head off of the patient.
So once you have your parameters set, you can then start your treatment by putting the gel on the applicator head. Make sure you have a nice amount on there. You want to feel out the landmark where you're going to apply. Work the gel in, tell your patient's going to be a little cool. Then you can start. So you're going to have a nice circular motion. You're not going to stop in one place. Just keep moving, apply a gentle pressure, and once you're done, you hit the stop button. Then you can take the applicator off. Make sure you dry off the applicator and your patient. And all set.